It is great to be here today, and I wanted to thank Eric for putting this together. I think this is a fantastic idea.
I appreciate that.
And also Suzanne for all the heavy lifting. And Eric's the electrician, I'm the plumber, so I'm going to sort of talk about plumbing issues here, okay? I will try not to kill you with too many slides, all right? It will not be death by PowerPoint here. And I don't think maybe I have one slide that's a graph. That's it, nothing else. So we're going to talk about chest pain. Is it really my heart or not? Shortness of breath, could it be my heart? And then we're going to talk briefly about, I take blood thinners, and we just talked about it a bunch, but I'm bleeding. Is there anything I can do about that? Is there any alternative? I'd say if you look at symptoms that people come in with, chest pain, shortness of breath, and then probably dizziness, and a cramp here and there. Those are the most common ones, all right? And so we'll start with chest pain because it's so common and yet it is so important that it's recognized for what it is. So if you look at chest pain and heart disease, right, this is what scares people. And it's incredible that with heart disease and blockages of the arteries to the heart, you can have pain from the top of your head down to your navel, and it may be the heart, okay? It be quite variable from patient to patient. It turns out that when I get coronary disease, it may be my arm that hurts when I exercise. If somebody else has it, it may be, a Hollywood heart attack, a big old elephant on the chest. Once you have a heart pain, you know what it is, and it doesn't change over time. But that first time you present with a symptom that's due to blockage of your heart, that's the most dangerous because people usually don't recognize it for what it is. Once you have a heart attack, you know what it is, and you won't miss it the next time. So what are some of the kind of tips that tell you, hey, this may well be my heart? So it tends to be central. The more it's centrally located, the more likely it is your heart. Your heart's right behind your sternum. It's not over here to your left side of your chest. So that's one thing. The higher it is up in the chest, the more likely it is your heart, okay? Heart pain, as Eric said, it isn't something that's there for a couple seconds, a buzz, a sharp pain. It has some duration to it, but it doesn't go on for days. If it goes on for days, you're dead. So, you're not going to come in to be seen. The other kind of factor is it tends to be exertional, right? That's when the heart wants a lot of blood flow. So if you're having some symptoms at rest and then you go out and you can run for 5 miles and you feel great, that's not your heart, okay? It's something else. So exertion is a good thing to pivot off of. And then the quality of the pain. Occasionally it can be sharp, but it's typically not sharp. Sometimes it can be burning, okay? And I can remember being an intern, going to the pharmacy, being called to a cardiac arrest, and there's the patient with Maalox around their mouth. They thought it was their GERD, thought it was their hiatal hernia. So sometimes it can be burning. Often it's just dull in nature, okay? You have any of these symptoms, you need to see your doctor, particularly if you've never had any heart disease, because who knows? It can, I can't tell you how many people have heart attacks in the dental chair because they've got jaw pain, right? That's their heart. That's their heart. So pretty much anything from here to there can potentially be your heart. Now, who is it that may have atypical symptoms? Women certainly do, but I'll tell you, women frequently have the same symptoms, they're just ignored. There's this perception that women don't have heart disease. They don't die from heart disease, they die from breast cancer. Heart disease is the #1 killer, okay? So frequently the symptoms are just ignored, but they may be a little more atypical. One of the symptoms that we'll talk about is shortness of breath. Frequently that's all people have. It's shortness of breath due to their blockage of their hearts. Diabetics often don't even have any symptoms. And if you look at them, 20% don't have any symptoms before a heart attack. So just give you some lay of the land with respect to chest pain and how to look at it. So the one that we're worried about, of course, is you've got blockages in the arteries, right? Some of those big, beautiful donuts out there end up in your coronaries and cause blockage. And, unfortunately, you don't have a lot of symptoms beforehand. Probably half of people don't have any symptoms except for the week before it. And you have a heart attack before it because you form a clot on top of that plaque very quickly. So you sort of have to, if you get substernal pain, it's bad, you start to sweat, it's time to call the ambulance, all right? That's another thing to take home. If you think you're having a heart attack, don't get in the car, call the ambulance. Over and over, we see people, they try and drive in, they drop dead in the car on the way in. You know, you have a cardiac arrhythmia, you don't make it. If you're in the ambulance, they can shock you and bring you back. So call the ambulance. Don't try and drive yourself. So if you do come in with chest pain and we think it potentially could be your heart, it's not something else, what do? Stress test is probably the first study that we would do along with an EKG. You don't have to run. If you can't run, there's all kinds of ways to do this with a chemical test, so you don't have to run. These days, we can actually do a CT. We'll talk a little bit about CT scoring later. But you can actually do a cath, essentially, by doing a CT with angiography. And we'll also often do ultrasound to look at the heart function. If we think you've got coronary disease, you may get a heart cath, okay? And these days, a heart cath, 95% of the times, we just go through the wrist to do it. So it's sort of amazing. In this particular patient, right here, this is all the blood flow to the heart. They've got the left main here. That's the widowmaker. All the arteries are busted here. And that's why this little cute kid's going, what in the hell? That looks bad. If you do have some blockage, there's 3 treatments. You could get medicine. You could get a stent that goes inside there to prop it open. Or you might need open heart surgery to do bypass surgery. You know, in this patient, they were elderly, so this is a few stents in there, and now it's wide open. You can see the difference between how open this is and how tight that is. Now, if it's not your heart, what else can it be? It can be anything in your chest or abdomen, right? Esophageal disease, hiatal hernia, GERD, frequently is a cause. You can get esophageal spasm. It can be everything like the heart. Your brain can't tell the esophagus from the heart many times. So, and that pain will get better with nitroglycerin. It could be gallbladder disease. It could be your pancreas. It could be lung, pleurisy, pneumonia. You can have a clot go to the lung. Or it can be the chest wall, arthritis, sternum, muscle, you pulled something. So there's lots of causes for it that are not necessarily the heart, but assume it's the heart until somebody tells you it's not. Okay? All right. Let's talk about shortness of breath, all right? We're going to talk about risk factors later. I do love, we see patients all the time that come in. What do you think? Am I at risk? Hell yes, you are, you know? So shortness of breath, yeah. This is really common, okay? This is really common too. Frequently, it can be the lungs, right? That's probably the most common. Asthma, you've got COPD, somebody that's smoked or they've been exposed to some sort of chemicals in the past that their lungs aren't working correctly. Clots go into the lungs, that can cause you to be short of breath. If you get anemic, if your blood count's low, often you're short of breath. That's your symptom. Or it can be your heart, and I'll tell you, frequently, whether it's blockage of the arteries, the heart's not pumping correctly, there's some problem with the valves, it's shortness of breath that people have. So if you're short of breath, all the things I said about chest pain are very applicable to shortness of breath. It can be the first sign, and often is the first sign of heart disease. One of the reasons you get short of breath is your valves may not work, right? We all have 4 valves. They allow the blood to go the right way, and particularly the valves in the left heart, which is the main pumper, the mitral valve and the aortic valve. When they don't work, when they're leaking or they're tight, they can cause all kinds of trouble, okay? So blood comes back from the lungs, it goes through the mitral valve right here that's got 2 flaps, and then it'll go through the aortic valve up top that looks like a Mercedes-Benz sign, okay? Frequently, valve disease is present in causing shortness of breath, and it's related to age, right? There's actually an epidemic of valvular disease because we're all living so long. I mean, our offices now, used to be, I hardly ever see anybody 90. It's all the time, you know, and now 100-year-olds come on in, all right? And valve disease, as you get less young, is much more common, okay? And when you tell somebody, you know, they're 100 and there's nothing to do, that's what they think about it. So lots and lots of patients with valve disease. Just remember that. And, you know, we'll talk about this, but the oldest patient, we did an aortic valve replacement through a catheter, 101 when we did him. He's now 104 and a half. He still gets on the treadmill every day and walks, and he takes a baby aspirin. That's it, okay? So there, you know, just because you're 90 is not a reason to give up, okay? The most common thing is this aortic stenosis that I talked about. That's the one that looks like Mercedes-Benz. On top is a good one. On the bottom, that's one that's all blocked up with calcium. Okay? Gets all calcified, blocked up. Blood backs up into your lungs, you're short of breath. That's what people come in with, often just exertional fatigue. And it used to be, you'd have to have open heart surgery, crack your sternum, replace that valve. There's some really good sound that goes with this. It's not on. These days, we can actually come up from the leg. It's like putting a stent in, okay? We come up, there's a valve, there's a balloon inside that valve, and much like a stent that we put in, we basically blow that balloon up, and the valve comes up and moves the old one out of the way, okay? And we pull that out, and back to the room, up, walking around later that afternoon, and most people go home the next day. It's kind of amazing technology. Generally, people moo after this, mostly cow stuff, but occasionally they oink and it's a pig tissue valve. What else could potentially cause shortness of breath? Okay? Being overweight, not exercising causes shortness of breath, period. Okay? And often that is the reason, and it's hard to admit that's the reason, but that's the reason for being short on his breath. There's a really, great doctor in town, and he's very famous, and he got short of breath, and he went all over town. He had every test known to man except for an autopsy. And finally, he comes in to see me and says, "I'm short of breath. Nobody can figure it out. Can you figure it out?" I said, "Mark, you've upped 40 pounds. You're short of breath because you're fat." And he said, "You're wrong. I'm going to lose it, and I'll be back. And then you can figure it out." And he came back in. He come in, and he said, "Shit, you were right." So losing weight will make your shortness of breath get better generally. Okay, finally, let's just talk about bleeding on blood thinner. We've talked about blood thinners. Eric just did a wonderful job. There's all kinds. I'm going to focus basically on the ones for atrial fib, but there's others after you get a stent, Plavix and aspirin. We could touch on that as well. And he's already hit on it. You got to take it to prevent a stroke. Unfortunately, a lot of people bleed on it, and they can't take it. So what do you do? Are there any alternatives to that? This is what a clot looks like in that darn appendage. Why God gave us that appendage, who knows? It's kind of like your appendix. It causes trouble and doesn't seem to have much value. So that's that place where those clots come, that appendage. It's a useless thing, like that sign not in use, or kind of this toilet paper invention, right? So they're useless. And there is an alternative. There's a way to put a plug in that to prevent those clots from coming out of there, and this is sort of the Watchman procedure. We put a little tube from the leg that comes up into that appendage, and then we drop that plug in there. And then that plug isolates the appendage, and it prevents any strokes related to atrial fib related to that. Now, 90% of the strokes, 90% of strokes in non-valvular AFib are related to that appendage. So if you can take a blood thinner, you're better off taking a blood thinner. Okay? So this is not an alternative. It's really for people that can't take their blood thinner. There's all kinds of new plugs coming. We looked at this one on the bottom. It's called the Amulet. It's a little bit like a pacifier. It's got a big disc on the outside, and then there's a plug on the inside. So there's all kinds of new stuff coming. Okay? So let's just summarize. So we talked about chest pain, right? I think if you've never had any heart disease and you don't know what your heart feels like when it's sick, you get chest pain, you need to see your doctor ASAP. If you particularly get it with exertion, and it goes away with exertion, it's in here, maybe it goes up to your jaw, goes up here, you need to see your doctor, okay? And get an answer. Get an answer. 2, shortness of breath, frequently the cause of heart disease, or is caused by heart disease. It could be blockage, but it could be your heart's weak, your valves don't work. Pretty much anything in the heart can cause you to be short of breath, so pay attention to it. If you're on blood thinners and you can't take them, there are alternatives, non-pharmacologic alternatives to reduce your risk of having a stroke. All kinds of new stuff coming, right? Every time Eric and I, all of us think we're done, there's nothing else. You know, they're smart young people who come up with new, you know, whether it's pharmaceutical or it's device related. There's lots of new things coming. So we can do this every year because there'll be new stuff every year. Thanks for your attention.